Hi, today we're going to talk about endocarditis. So first I'll just do a quick review of the structure of the heart. The inner layer of the heart that forms the four heart valves is called the endocardium. Endocarditis is the inflammation of the valves of the heart secondary to an infection. It is life-threatening illness and it requires prompt diagnosis and treatment. This type of infection can be acquired in the community or from a healthcare exposure. Research has shown that 40% of cases of endocarditis are healthcare acquired. Most who suffer from the disease are elderly and or suffering from other illnesses or have a prosthetic cardiac device such as a defibrillator, prosthetic valve, or a pacemaker. For pathophysiology, we'll discuss the most common bacteria that causes endocarditis, and those are Staphylococcus, Streptococci, and Enterococci. These organisms typically enter the bloodstream from a dental abscess, skin infection, or infected vascular catheter. In most cases of endocarditis, a vegetation of these bacteria will occur, and this happens when first there's an injury to the endocardial tissue, followed by an adherence of platelets and fibrin, forming what is called a nidus. So the circulating bacteria are then able to adhere to that nidus, and further bacterial growth within the nidus causes activation of the coagulation system via the extrinsic clotting pathway. Monocytes release cytokines, and activated endothelial cells lead to more production of fibronectin, and that develops into a vegetation of bacteria on that endocardium. Some bacteria, such as Staph aureus, do not need to rely on an injury to the endocardial tissue, and they're able just to enter the endothelial cells directly through extracellular matrix binding proteins like fibronectin. Once those bacteria have entered the endothelial cells, cytokines and tissue factors are released, and again causing more inflammation and blood clotting. So endocarditis mostly affects the mitral and aortic valves, with the exception of IV drug users where typically we'll see the infection in their tricuspid valve. Patients can suffer from heart failure, particularly if the aortic valve is damaged, because there's a disruption of the blood flow and a decreased cardiac output of the left ventricle. Patients who have endocarditis that is affecting that left side of their heart are also at higher risk of septic emboli. That's when the vegetations that we were just discussing, the vegetations of bacteria, can break free from the endocardium and enter the circulatory system. So those emboli of bacteria then, once entering the circulating system, they block blood flow to major vessels throughout the body, and that can cause stroke, ischemia of the extremities, splenic or renal infarcts, and pulmonary embolism. People who are at risk for developing endocarditis include IV drug users. Those patients will have more likely, with those patients we'll see Staph aureus because, let me rephrase that. These patients who are IV drug users, when they're injecting needles, unclean needles, or contaminated drugs, we're more likely to see the bacteria Staph aureus that enters their blood. People with poor dentition or an active dental infection are also at high risk. Oral streptococci is the common bacteria that can enter the bloodstream through the gums and then ultimately cause endocarditis. People who have a history of valvular disease, such as rheumatic heart disease or mitral valve prolapse, are also at higher risk due to the disruption of blood flow from the inflammation to the structure of their heart. People who have artificial cardiac valves, pacemakers, or vascular catheters are all at higher risk for endocarditis, because anytime you have an artificial implant in your body, it can introduce bacteria. So major signs and symptoms include those of a systemic infection. These patients will have fever, malaise, myalgia. Due to the disruption of blood flow because of the inflammation in the valves, the patients will have a cardiac murmur that will be auscultated, and that's noted in about 85% of patients suffering from endocarditis. Later findings of the disease will include the results of septic emboli that could be breaking off, causing neurological impairments. So patients will appear like they're having a stroke. If the septic emboli are affecting the vasculature to the kidneys, they could have renal failure, and then they could have ischemia of the extremities. This picture just shows the presence of bacteria adhering to the fibronectin and penetrating the endothelial cells. So lab findings with these patients will draw a CBC and find that their white blood cells are elevated. We'll also notice that they'll have elevated erythrocyte sedimentation rates and C-reactive protein levels because of the inflammation that's happening. Blood cultures are very important because we need to specifically identify what bacteria is causing the problem so that we can treat it appropriately. Echocardiography is recommended for anyone that has suspected endocarditis. Most typically, a TTE will be ordered, the transthoracic echo, because it's less invasive, but it's not as sensitive. So if there's still suspicion, if that test comes back negative and there is still high suspicion, then a transesophageal echocardiograph should be ordered because it's more sensitive. It will allow the provider to identify an abscess, any valve dysfunction, or even a possible leaflet perforation. These patients will be treated with antibiotics, and again, it's very important to have the blood culture results so that we can pick the appropriate antibiotic that's specific to the bacteria that grows. And then once they've finished their course of antibiotics, another TTE should be ordered so that the provider can assess for any valve damage or dysfunction. Some patients may have enough valve impairment that surgery may be required, and also if there's an abscess on the valve and it's not responding to antibiotics, they may require valve surgery. And any patients that have if the cause of the infection is found to be a prosthetic device like a pacemaker, defibrillator, a dialysis catheter, a PICC line, then those devices will be removed. And that concludes my discussion on endocarditis. I hope you enjoyed it.